Hello, my name is Erica Leonard, and this presentation is titled Kolcaba's Comfort Theory Concept Map. This presentation will include a concept map of the nurse's role in enhancing comfort in the intensive care unit patient with COVID-19, utilizing the comfort theory developed by Kolcaba. I will then provide a brief overview of key principles of the nursing theory, including connections to the meta paradigm of nursing, key theoretical assumptions, and propositions. This concept map will be centralized around the nurse's role in enhancing comfort in the intensive care unit patient with COVID-19. The four cells that branch off of the central cell are the four concepts of healthcare needs. These are physical needs, sociocultural needs, psychospiritual needs, and environmental needs. Physical needs and comfort are important considerations when caring for a patient with COVID-19. Physical positioning is essential to utilize to promote comfort. Early in the pandemic, research was indicating prone positioning to be beneficial in optimizing oxygenation in severe cases of acute respiratory distress syndrome. By effectively utilizing lung tissue, improved oxygenation occurs, collaterally enhancing comfort. Another aspect of tailoring care to physical needs of an ICU patient with COVID-19 is by maintaining skin integrity. One way that we can maintain skin integrity is by providing optimal nutrition. By providing optimal nutrition, we are providing the basic cellular needs required for bodily functions. By mindfully and intentionally meeting basic needs of the body, we can achieve comfort. As an institution, we utilized research and data to guide best practice and built a policy to initiate enteral nutrition within 24 hours of intubation to promote gut health within our critically ill population. An additional way that we can maintain skin integrity in an ICU patient with COVID-19 is by repositioning to offload pressure every 2 hours. By reducing the risk of impaired skin integrity, we are promoting comfort. The second concept of healthcare needs is a patient's sociocultural needs. During the pandemic, visiting was restricted from family members unless a compassionate visit was occurring. A major characteristic of sociocultural needs is family support. Providing family support during illness is a large factor in optimizing comfort. With the visitor restrictions, utilizing technology to enhance communication between patients and their loved ones was absolutely necessary. Through applications like Zoom and FaceTime, family traditions, rituals, and religion were facilitated to ease worries and anxieties. The third concept of healthcare needs relates to a patient's environment. This is a factor that nurses can manipulate to enhance comfort in the ICU patient with COVID-19. In patients who are intubated and sedated, enhancing rest occurs with limiting noise reduction and stimuli such as lights. As a basic human need, enhancing rest promotes relief, which is a type of comfort. Additionally, music therapy is a tool that can be utilized by nurses to ease anxiety and facilitate relaxation. Another tool to facilitate relaxation is through manipulation of room temperature to maintain normothermia. Through nursing assessment and skill, we can ensure our patients are not sweating or shivering. The fourth concept of healthcare needs relates to psychospiritual needs. As a nurse caring for an ICU patient with COVID-19, it is critical to assess ways to provide spiritual support. In acute populations where patients are intubated and sedated, this can be done through communication with family. Once a spiritual avenue has been established, nursing can mobilize spiritual support through chaplain services. Additionally, physical religious representation through symbols and objects help to support comfort through transcendence. Lastly, within the nurse's role in enhancing comfort in the intensive care unit patient with COVID-19, it is essential to respect and care for the internal and external needs of each patient. Paying mind to health-seeking behaviors allows us to intentionally and therapeutically assist patients with healing and with dignified death when our therapy modalities fail. Kolcaba's comfort theory is based on the assumptions that the need for comfort is basic. Persons experience comfort holistically, self-comforting measures can be healthy or unhealthy, and enhanced comfort leads to greater productivity. Within this theory, comfort is defined as an outcome of intentional, patient-family-focused quality care. There are three types of comfort. Relief is the state of having a specific comfort need met. Ease is the state of calm, of contentment, and transcendence is the state in which one can rise above problems or pain. These types of comfort require intention and skilled nursing intervention to achieve. The four contexts in which comfort is experienced by patients are physical, pertaining to bodily sensations, immune function, etc., psychospiritual, pertaining to internal awareness of self, identity, meaning in one's life, sociocultural, pertaining to interpersonal, family, and societal relationships, and environmental, pertaining to external human experiences. The four contexts in which comfort is experienced makes up a patient's healthcare needs. Nursing interventions within this theory are defined as intentional actions designed to address comfort needs. The three types of comfort interventions are technical, coaching, and comfort food for the soul. Technical interventions describes task-oriented actions such as medication administration, insertion of lines, and so on. Coaching describes supportive nursing actions such as active listening or healing music. And comfort food for the soul describes the holistic, time-oriented interventions such as music or art therapy, a back massage, where the nurse is going out of her way to support comfort in a patient. Next, intervening variables are defined as interacting forces that influence a patient's perception of total comfort. This can be past experiences, age, emotional state, education status, etc. These factors can place implicit bias, hindering comfort. It is through nursing interventions and assessment of intervening variables that we can achieve enhanced comfort. With enhanced comfort comes the idea of health-seeking behaviors. This is a broad category of outcomes related to the pursuit of health and includes internal behaviors, external behaviors, and also encompasses the idea of a peaceful death. Internal behaviors relates to choices in one's perception of illness and health. External behaviors are actions that promote health, such as choosing an apple instead of fries. And lastly, a peaceful death is included within this idea of health-seeking behaviors, which allows one to accept illness and choose a dignified passing. With caring as a core value within institutions, this concept provides institutional integrity, as it can produce viable evidence for best practices and best policies. Best practices and policies are evidence-based healthcare interventions that have been shown through research to produce optimal outcomes. Ultimately, the theory of caring is individualized, efficient, holistic, and therapeutic. This theory connects to the meta-paradigm of nursing as it places the patient in the center of holistic nursing care, includes internal and external environmental focus to achieve optimal health outcomes through tailored nursing interventions. Kolcaba's theory guides nurses to detect comfort needs that are not being addressed and to develop interventions to meet those needs. Through intuition, intention, presence, and meaningful moments, comfort can be achieved. Thank you.